Hi everyone, I'm Dr. Angela, and we're going to show you how to load and inject your peptides today. So here's what I want you to plan ahead before you do anything. You have your vial, you have your syringe, and you have your alcohol wipes. Make sure you wash your hands and a clean surface. I usually will take a piece of paper towel and set it down on my counter, and I kind of just put everything right on that paper towel. All right, so the things you need to know is your alcohol wipe, you can tear this open. And with your peptide, you actually can go, you can see kind of the bullseye. And this is where you want to really clean and get into that where that rubber is, because that is where we're going to put the needle in to draw out the solution. Now set your alcohol wipe. I usually just set it right back on here or on the paper towel because you're going to need to cleanse the area that you're going to inject. But let's first show you how to load your syringe. So pop this end off. That's garbage. You can set it aside. It's recyclable. It's plastic. And now you have your needle. So the first thing you're going to do, my glasses on for this, is you're going to pop this end off, and I usually set it right here because I will put this back on before I usually inject. So we have this bullseye in the middle. Let's see, you can kind of see that center area. We want to take the needle, we want to, it's got to go in that center area. Otherwise, you're just going into the rubber. So we want to insert it right into the middle. So you can kind of see that. And you want to be careful not to move this around too much because you don't want to bend your needle. What's nice with the 5/16 inch is that it has less likelihood to bend than like a half-inch needle. We're going to tip it, well, before we tip it upside down, let's say you're on microdosing of GLP. You're going to want to draw it out. And if 25 units is where you start, or if you've been guided to split your first week's dosing just to help with easing the body, kind of gradually entering this into the body to kind of acclimate the body, you can pull it out to 25 units. And what you're going to look at, since this is just my demo here, you can see the units. This is harder to do than I thought. This rubber stopper at the bottom, you want the bottom of this that's closest to the needle. You want that to come to that about a 20, I take it past a little bit further. So if I want 25 units, I might draw this needle out to 30. So I'm gonna draw it out to 30. And then what I'm gonna do is I'm gonna tip this upside down, and you'll have your solution in here. You can kind of see it wiggling around. And now I'm going to slowly just push this in. This creates like a vacuum. You might even be able to see the little bubbles in there. And now remember this stopper, this the one that's the end that's closest to the needle. We want to draw that out if your dose is 25 or 20 or 10, whatever your units is. We're going to draw that out, and I'm going to draw it out. I'm going to just say, this is BPC, so it's 10 units. So I'm going to draw it out to 10 units because that's what I am going to take. And you can see my stopper is right at the 21 mark, at the end that is right at closest to the needle. And then you make sure there's not like a big air bubble in there because you might have to push it back in and bring it back out a little bit. And then I just give it a couple good snaps. Now, you might have a few little tiny bubbles at the very top. It's very hard to get every little bubble out. We just don't want those big air bubbles in there. So you might actually have to snap it a little bit, and you might actually have to come back and stick this back in to the vial. And you might have to push it back up and draw out again. So I'm just going to do it for sake of argument. Okay, so we have our 20 units of BPC. And now if this is a GLP, and I'm going to do another video on the whole GLP once you get it, and some tips and things that I recommend for people. So now you can do one of two things. You can either put the cap back on, be careful so it doesn't like stick into the plastic, make sure it's in there, and then you can set it back down, and now you can take your alcohol wipe, and we're going to wipe the area. I'm going to talk to you about a couple different areas with the different peptides. Okay, so with GLPs, there are a couple areas that you can consider dosing. I'm going to tell you the benefits of certain areas. If you are a very sensitive person, the stomach might not be the best place for you to inject. I've had feedback from people that once I started injecting in my hip area or that flank area, it tends not to give me as much nausea, and I don't have any kind of side effects. Okay, so what we want to do is If you're going to inject in the belly, lower this just a little. If we're going to inject in the belly, we have our belly button. You want to be at least 2 fingertips away from the belly button. So wherever you're injecting, you want to have it away from the belly button. So you can kind of come over, and I always do a bigger area than what I need. So if we're going to inject in the stomach, that's what we would do. And then we would just pinch it and we'll inject it. The other area is to get out here and grab out away from the stomach. So you can grab here. You can actually come down and grab out into the outer thigh or kind of outer hip area. You want to make sure you can get a good pinch, right? So I'm gonna, I'll just do it by my stomach. So we can just grab, we're gonna wipe this whole area. That way, because I can't remember exactly. I mean, I can kind of feel it. Now, wait 30 seconds before you inject, because when you inject it and alcohol is on there, it gets a little bit of a sting because, well, you're pushing alcohol into the skin. So we want to kind of ease up on that. All right, so it's pretty dry. So we're gonna take this off, and now we're gonna pinch. And here's the thing, you can go straight in, but it's gonna feel more like a poke. If we come and we do just a slight, like here's straight in, and here is just a little bit of a 45-degree angle. It's kind of like when you take and you have a sliver. If you go straight in, it feels like a poke. But if you go in just with a slight angle, it doesn't feel so like you just don't even feel it. And you can, if you're kind of like nervous, I would almost pinch it like a little tighter. Okay, so we're going to pinch and we're going to come in. Now, this isn't, you don't want to poke yourself because it's going to feel like a poke. You want to come in with a little bit of force. So you just can kind of come in and you just pierce it through the skin and then make sure it is in your skin, right? Don't, and I mean, I didn't even feel that. So make sure the needle is into the skin because the last thing you want is your liquid gold running down your belly or your thigh, and then just slowly push in the solution. And that's it. Then what I do, I don't like to have all these containers around. I actually, you can buy like uh, needle clip from Amazon. They're like 10 or 12 bucks or something like that. But what I do is I just stick it in here and I just break off the needle and then I throw it in my recyclables. The other thing you can get is you can do a laundry detergent container. That's what I have at my office. So people can come in, I just load the syringes up in there for people who, maybe are hiding it from somebody. And they don't want people to know they have all these needles, so they bring them to me. But that is it. And then you want to make sure you store this in the fridge. Our peptides do need to be refrigerated. And just there's really no magic to it. It's pretty simple. The needles are very small, and don't be fearful of it, but you do have to kind of come in with a little bit of pressure. Don't like poke the skin until you get used to it. Kind of go in with a little bit of force. So I hope that helps with your injections. And if you have any questions, just please reach out to whoever is your person that helped you get signed up for Ellie, or you can always message me on Facebook Messenger at Angela Rom, and I will assist you any way that I can. All right, thanks.